फोन कंटिन्यू कर इथे उभी राहा. Okay, so I'm extremely sorry. That time there was some glitch of the internet. Internet problems is there, so I couldn't complete my presentation. I repeat my presentation. Hope so you understand. So shall I start my presentation?
Yeah, you can start. Yeah.
Okay, thank you for giving me a chance to continue my presentation. I am very much thankful for your understanding. So the topic is an innovative approach towards the oral activity that is based on the radiology research. I am Dr. Rahul Hajare. I am a professor. I am a Sandip University School of Pharmaceutical Sciences, Nashik. I am a postdoctorate also. I am a postdoc from ICMR. I am a scholar of Hindu University of America, Florida. So now, first we'll see the abstract. The radiology is a medical discipline that uses medical imaging to diagnose and treat disease within the bodies of animals, including humans. There are variety of imaging techniques such as X-ray, radiography, ultrasound, computer topography, nuclear magnetic resonance imaging, MRI are used to diagnose or treat diseases. Radiography is widely used diagnostics method. It is a more convenient and give proper result, and so also easily accessible, even show minute parts of the bones and hard tissues and teeth with more detail on it. A descriptive cross-sectional study was done to analyze knowledge, attitude, and practice of the radiography among the dentists. Radiology is a medical discipline that uses medicinal imaging and treat disease within the bodies of animals, including the humans. There are a variety of imaging techniques such as X-ray, radiography, ultrasound, computer tomography, nuclear magnetic resonance, MRI, are used to diagnose to treat diseases. Radiography is widely used diagnosis method. It is more convenient and gives proper result, and also easily accessible, even shows minute parts of the bones or hard tissues and teeth with more details on it. A descriptive cross-sectional study was done to analyze knowledge, attitude, and practice of radiography among the dentists. The survey was conducted among the 100 dentists. It was online survey using Google Form. A self-administered questionnaires of 10 close-ended and open question was prepared and distributed among the dentists through the online-based survey form Google Form. The responses were collected, tabulated in Excel sheet, and analyzed using statistical package for social sciences version 23. And results were represented in a bar and pie graph. Chart state, that is, a statistic was used to analyze the data entered by the dentist. Thus, the present study was concluded that radiograph diagnosis play a major role in the field of the dentistry. Introductions, I included radiology is the medical discipline that uses medical imaging to diagnose and treat diseases within the bodies of the animal, including the human. There are a variety of imaging techniques such as X-ray, radiography, ultrasound, computer tomography, MRI are used to diagnose or treat the diseases. On the November 1895, Wilhelm accidentally discovered an image formed due to the reflection of cathode rays. After a few weeks, Wilhelm used his wife's hand for experiment to get X-ray image by making the hands to lay on the photographic plate. That was the innovation. That is the innovation. Some cathode rays are allowed to pass through her hand, and Wilhelm noted the intensity of reflected cathode rays by using photographic plate. In older days, people use film-based radiography, which require the presence of dark room, and it may also have some error associated with the process of all this problem are overcome by using the digital radiography later, which is generated by the computer to reduce the error. Radiology is more important in the field of dentistry because we cannot see the actual structure of our teeth behind the skin. So the radiography will help in picturing the structure. Most commonly used radiography is X-ray, that is common in India. X-ray produce or transmit X-ray through the patient, which will be pictured by computer for final structure. Fluoroscopy, in this fluorescent screen, an image transfer tube is connected to a closed circuit television system. This allows real-time imaging of the structure in motion and augmented with the radio contrast agent. Computer tomography, also known as a CT, it has a ring-shaped aperture rotate around the patient, producing a computer-generated cross-sectional image. Ultrasound waves are passed through the body and reflect rays intensity is calculated in the computer to get a structure of teeth, bone, and heart tissues of our body. Magnetic imaging, that is the MRI, uses to a strong magnetic field, which is then passed through a subject body so that nuclei align themselves due to the strong magnetic. Then the radio signal and radio frequency of nuclei is analyzed in a computer for the final output. Now the material and methods and the research design is developed by including the 100 dentists. A descriptive cross-sectional study was done to analyze the knowledge, attitude, and practice of radiography among the dentists. The survey was conducted among the 100 dentists in India. It was an online survey using the Google form. A self-administered questionnaire of 10 close-ended and open question was prepared and distributed among the dentists through the online-based survey form in the Google form is given to them. The responses were collected, tabulated in Excel sheet and analyzed using the particular package of the statistic, that is a statistical package for the social sciences. Version 23, it is the advanced. And results were represented in a bar and pie graph. Chi-square test was used to analyze the data entered by the dentist. Questionnaires I was prepared. There are 10 questions I was prepared to the dentist. How this technology is helpful. The first question is that how is radio diagnosis important in the field of the dentistry? Option is given: important, very important, utmost important. Second question I have given to them: in which section of dentistry where diagnosis is mostly used? Endodontic, orthodontic, prosthodontic, oral medicine. Next question is that what imaging modality has been mostly used in the field of dentistry? Computed tomography, MRI, X-ray based imaging, ultrasound, all of this. How orthopantogram used in the field of the dentistry? Very useful, less useful. In aesthetic dentistry, how the radio diagnostic is important, very important, utmost important. Next question is that which radio diagnosis technique is very essential to identify the malignant condition in and around the oral cavity? Yes, no, and maybe. In nuclear medicine, used in the field of the dentistry for imaging? Yes, no, or maybe. So these are all the questionnaires is given to the dentist, his doctors. The present study has shown as the following figures. These are the following figures. In that there is a mention the result. Endodontics, it mentioned the 22%. Oral medicine, it mentioned the 23%. Orthodontic, it mentioned the 36%, and prosthodontic is mentioned the 72%. Useful of this technology that is a CT, that is a computer, that is a CT technology is there. So the figure 1, figure 1, that is earlier I have seen to you. About the 37% of the dentist responded orthodontic is a field where radio diagnosis is mostly used. That was a positive feedback from the dentist. That was a very good, you can say that it was a very good feedback, you can say. 23% responded oral medicine, 23% responded endodontic, and 17% responded for the prosthodontic. Green represent the oral medicine, being represent the orthodontic, while the it is represent the orthodontic, and the blue represent the endodontic. Overall conclusion is very simple. Research is very short. It was a preliminary research, and the doctors given a very good result from the radio diagnosis. That was a radio diagnosis. It was a higher version in India because the no one the dentist should be use the this technology for the oral activity. For oral activity, they just use the traditional. It may be the conventional, not the things is there. Okay, that is a reason behind to represent this research. Okay, how the radio diagnosis is helpful for the dentistry science. About the figure 2, about 37% of the dentists responded that all of the given options are mostly used in the field of the dentistry. 27% responded X-base imaging, 14% responded ultrasound, 10% responded MRI, 12% computed tomography is mostly used in the field of the industry. Blue represent all of the above, green represent computed tomography, being represent MRI, while it represent ultrasound, yellow represent X-ray based imaging. The overall, this diagram has represent what the modality that has been mostly in the field of the dentistry, how the radio diagnosis is important. Radio diagnosis is important. Radio diagnosis, it's a painless because the your teeth should be a place in the very minor, very small, and very delicate tissues. It will be the now in India it is all about the painful technology. So these are the how the painless that should be demanded in the future. Figure 3, 57% of the dentists responding to computed tomography is a very useful. That is a very good sign to find a malignant condition in around the oral cavity. If there is any oral cavity, the malignant, that is a malignance, that is a tumor in a oral, okay, that should be identified any of the other tests. That is a radio diagnosis is one of the important. 43% of the dentists responded that MRI is very useful to find a malignant condition in and around the oral cavity. Blue represent the computer tomography and green represent the MRI. So the MRI and computer tomography, it is ultimate solution for the oral cavity diagnosis in a various ranges. So the above bar graph represent the association between the importance of the radiology, importance of radiology and frequently used modality of the radiology. X-axis represent the importance of the radiology. X-axis, that is utmost important and very important. Y-axis represent the number of responses for the following question. Responses I have collected. What imaging modality has been mostly used in the field of dentistry? The majority of the respondent who said radiology is the important thing, all of the above. Modality is the most used, in which blue represent all of this, green represent computed tomography, violet represent ultrasound, yellow represent X-ray based imaging. I would like to say the responses, if you get a positive responses, the researcher should be the happy because the responses are the very painless. Responses are the very good and the all are showing the it should be a important sign they want to say, they want to give a message how it is important. Responses are the very positive for this technology. Figure 5, the above bar graph represent the association between the importance of radiology and the idea of respondent of the nuclear medicine. X-axis represent the importance of the radiology and Y-axis represent the response of the questionnaires. Nuclear medicines in the field of the industry imaging is one of the important. This is the bar graph. It is for the nuclear medicine how much they are important. The majority of the respondent who said Radiology is important thing. Nuclear medicine is used to field of dentistry because the in at present in 2040, right from the 1947, right from the 1947, no dentist should be used the nuclear medicine for the oral cavity. This is the first time in which the green represent no, beige represent yes, blue represent maybe. Person child square test shows the significant value, that is a 00 error, which is statistical significant. There is a no error. There is no error. There is no probability. Whatever the it should be the zero error technology. Discussion. Recent advances in imaging technology have revolutionized dental diagnostic and treatment planning. Correct use of the appropriate imaging technology and their correct interpretation, following as low as reasonably achievable principle and cost effective. Technology is a cost effective. The common people may are capable, they acquire this technology because it's a cost effective. Newer radiographic techniques can help detect the pathologic in very clearly stage should be the very clear, which ultimately help to reduce the mortality. That is one of the important, which ultimately help to reduce the morbidity and mortality, death rate. To improve the quality of life of patient, radiography helps to diagnose the treatment of bone, teeth, and also the heart tissue. Conclusion. In general in general emerging advances in the field of the radiology and medical imaging are really necessary to detect and locate the diseases condition, especially in the field of the dentistry. Radiodiagnosis play a major role in visualizing the structure present in the oral cavity. For example, seeing the pulp cavity, placing the master cone in the pulp is detected by the radio imaging the root canal treatment procedure. Root canal, it is one of the common therapy. Should be people should be people should be as a they should be prefer the root canal treatment for the oral cavity. Thus, the present study conclude that the radio diagnosis is the utmost important in all aspects of the clinical dentistry. This is the important slides. Important slides. I would like to acknowledge. I would like to express my gratitude to highly respected, world-renowned scientist, Dr. Ramesh Pananspe, esteemed laboratory scientist and retired director, National AIDS Research Institute, Pune, being a great knowledge source for this work. I seek continuous support for my research career. Thank you. This is my presentation. If you have